In healthy people, the secretion of cortisol follows a circadian rhythm. Secretion peaks at 8 a.m. and is relatively lower in the evening and early morning hours. Excessive secretion of adrenocorticotropic hormone by the pituitary leads to excessive secretion of cortisol from the adrenal cortex. This makes the adrenal glands grow larger, and this has been proven on computerized axial tomography scans. For the adrenal glands to return to normal, a patient has to live in a harmonious environment for an extended period of time and manage their state of mind within that harmonious environment effectively. Drugs that activate or inhibit adenylyl cyclase or stimulate phosphoinositide turnover work directly on serotonergic and adrenergic pathways. Lithium dampens excessive neural activity in mania for many patients. If an individual is under pressure and their adrenal glands are enlarged as a result, then there are behavioral activation strategies that can be implemented instead of using psychiatric drugs. If the 6 main cell groups in the brain are in balance, then it's easier to use natural methods to manage an individual's stress levels. Drugs and alcohol cause severe imbalances in the brain, which throw the 6 main cell groups out of balance and sometimes cause permanent brain damage, so the individual cannot then use behavioral activation to manage their state of mind and their life. The serotonergic and dopaminergic pathways are well understood. The adrenergic, noradrenergic, cholinergic, and histaminergic pathways within the brain are not well understood by people that haven't studied medicine. So your average person will focus on raising their serotonin levels and their dopamine levels, but they won't do anything consciously to activate their histaminergic, cholinergic, and noradrenergic pathways. Adrenergic pathways are usually activated far too much, and the noradrenergic pathways are usually neglected. Neurotransmitters like oxytocin and GABA help to calm down manic or anxious patients so that they can respond to life's events normally again. Oxytocin and GABA can be activated through behavioral activation strategies. Remember, the brain doesn't know the difference between something you imagine and something you vividly experience. So visualizing yourself or watching others engage in activities that release GABA and oxytocin can stimulate the brain in the same way through mirror neurons. Mirror neurons are more activated when you observe others acting out a behavior that you engage in regularly. Living a healthy, balanced lifestyle and surrounding yourself with positive influences is the key.